and Hashimoto's thyroid disease. So this is kind of an interesting topic to me, and so low-dose naltrexone is now being used by mostly alternative medical doctors for Hashimoto's. And the reason it's interesting to me is because Hashimoto's is an autoimmune disease. So having been in the Hashimoto's pool probably since the inception of people realizing that Hashimoto's was an actual cause of their hypothyroidism, I've watched the medical community struggle with this because they're kind of boxed into it's a thyroid problem when it's actually an autoimmune problem. And they were totally boxed into that for probably the first 10 or 11 or 12 years that I was aware of Hashimoto's. So you would go to the doctor, they would look at you, they'd say your thyroid is normal, and they would, and then all of the symptoms that you got of Hashimoto's, they would treat with a different medication. So if you had constipation, they give you some for that, and if you had pain, they give you some for that, and if you had, migraines, or if you had, or if you're overweight, they would try to give you something for that. So that's kind of how it was. The fact that it was an autoimmune problem was not even like considered. And then later on, they started getting a little bit more. The medical community started getting a little bit more like, okay, this is an autoimmune problem, but we're still just going to give you the TSH, and we're still just going to give you like all these drugs for all the different symptoms that the Hashimoto's is actually doing. And then just in the last couple of years, now I'm in Reno, Nevada, and this has been a kind of, I know people think of Reno, Nevada, they probably think more of like casinos and divorce and things that we've been gambling, and things that we've been famous for, prostitution that we've been famous for forever, right? They probably don't think that we're an alternative mecca, but this was like the alternative mecca of the country for years in the 70s, early 80s. Because if we had all those other things, then why not have alternative medicine, right? When alternative medicine wasn't very popular in any of the other states. So we have a lot of alternative medical practitioners here, and they're kind of forward thinking. So this group seems to have started thinking, this is an autoimmune problem. So maybe we should treat the autoimmunity. So I have a number of colleagues that will try hydrocortisone, which is an autoimmune, which is a anti-inflammatory steroidish medication. Why? Because that dampens autoimmune responses. That's pretty aggressive, and a lot of the doctors. One that used to work here, as a matter of fact, I've had the pleasure of working with a couple of osteopaths here over the years, and one of them really turned me on to the low dose naltrexone. So basically, low dose naltrexone was another acknowledgement that it's the thyroid being attacked. It's not particularly the thyroid that is the main problem initially. Ultimately, it becomes the problem because so much destruction. But we have to get inflammation down. And low dose naltrexone is a medication that what it does is it creates endorphins. Endorphins, the feel good hormone. And if you're a runner, you know what endorphins are. If you're a runner, like the first 5 or 6 or 7 or 8 minutes is a grind. And then after that, all of a sudden you start getting this like, and then you go into euphoria. And so endorphins are what makes us feel good. When we feel good, we're expressing endorphins. And when you feel good, those endorphins will dampen inflammation. And then, so it's not like a heavy duty approach like steroids, okay? But it does help certain people to dampen the symptoms. It frequently comes with, and I've tried it, okay? It frequently comes with nightmares. And I've heard that a lot from a lot of patients. I just had one a couple of days ago, and so I tried the low dose naltrexone, and I was feeling better, but oh my God, the nightmares I was having, like I was wake up and I was just like worn out and all that type of stuff. That's like the main negative side effect of it. I'm not a medical doctor, by the way, just for the record. I'm not prescribing you to go take low dose naltrexone. But that's what it does, and it can be an adjunct. What it is though, it is a Band-Aid. Okay, it is a Band-Aid. It is not fixing anything. It's not getting to the, you're not digging into what the root causes are. of all of the triggers that are causing the inflammation that is that's affecting your thyroid. I mean, as I'm sitting here yapping away, my brain's going, CBD oil is probably superior to that if you're a CBD oil fan, because CBD oil also dampens inflammation, and that can help too. But neither one of them is like, I don't even use CBD oil, and I don't refer for low dose naltrexone, because, and it's not that it's not in my arsenal, it's that if you follow the proper procedures to go after your thyroid, and you find out what the triggers are, and you get things like your blood sugar under control, and certain lifestyle changes, and if you have toxins or don't have if you get those under control, then that actually is more dampening the root causes and controlling the immune response and putting that person into remission, as opposed to just dampening it with those types of things. But it's a legitimate tool in the toolbox for somebody who may be stuck when they're treating a patient and they want to give the patient some dampening of the immune inflammatory response, which can dampen a lot of symptoms. And again, the main problem with it is in nightmares. And it's not something that just happens occasionally. I have talked to scores of people who've taken it who've gotten nightmares. So that's kind of what I know about it. That's kind of what I've experienced with it from treating fibromyalgia patients and Hashimoto's patients in particular. So hope that's helpful. And I think that's all I have on it. So, okay, take care.